Welcome back live to OTR. The governor is still with us this morning. As you can see, we're joined at the table by the state's Commissioner of Public Health, Dr. Monica Burrell. Doctor, thank you so much for joining us this morning.
So there are models out there predicting the number of likely confirmed cases. One from the Harvard Public School Health estimates that if 20% are infected, that would translate to over 1 million people in Massachusetts. Does that number seem accurate to either of you?
Over what period of time? I mean, that's really the key question here, right? Because the whole goal here is to avoid the spike. If we end up with spreading that out over a long period of time, 80% of them basically have something that feels like the flu. You got another group of people who are going to be hospitalized, but maybe not for a long period of time. And then you got the folks for whom this is going to be a life or death situation.
Well, let's say for the rest of this year, let's over the next few months, many months.
You're a lot smarter about this than me, but it seems to me the goal should be to use social distancing on other vehicles to avoid ending up in that situation. But if you look at the data from other parts of the world, I don't think it's completely unreasonable.
Doctor?
The evidence is unfolding on this. Every day we learn more about this disease. I think part of the reason why this disease frightens people is because we are still learning about it. It is a new strain of coronavirus, and COVID-19, the information is evolving every day. What we do know is that most individuals who get this illness will recover on their own, the vast majority. So what we are all trying to collectively do is to make sure that we do the social distancing that the governor is talking about, so that each one of us takes responsibility to not only not exposing ourselves, but exposing those who are at highest risk, which you spoke about a little bit, individuals who are over the age of 60 and with underlying health conditions.
Can I say one other thing, just because I think it's important? Swine flu.
Yeah.
2009, 2010, 60 million people in the U.S. got swine flu, but they got it over a year and almost a year and a half.
Right.
And I think to some extent the big issue here is the numbers are hugely important. The level of contagiousness is hugely important. But the other thing to remember here is it's the compressed nature of the time frame, which is really what the healthcare community at least has said to me is the thing they need us to work hardest on to spread the thing out.
You've been saying that you're going to release the number of people tested every week, but some hospitals are saying that they really need these numbers every day. Could you change that? Will you be letting hospitals know how many people are being tested every day?
So cumulatively, since we started doing the test on the 28th of February, we've tested at the State Public Health Lab 799 individuals. We have followed the guidance and the requirements of the CDC of who could get tested. And as that has changed and that's broadened, as the science, the facts, the data evolves, we have expanded the capacity to test. And we are very appreciative that now commercial labs have also been able to come on board.
So daily
and
stats?
This will greatly expand. This will greatly expand.
Do you think
numbers.
You'll be at a point where you're revealing daily statistics, daily numbers?
We will put out all the information that we have in a way that is accurate and timely so that individuals can be informed. Right now, if you go to our website, you can find the information about number of individuals and some of those details.
Is the goal daily release?
I'd love to get to daily, but remember, you're going to have a bunch. Let's suppose we get to the point where we're doing literally hundreds or maybe potentially even thousands of tests a day. That's going to be so you're going to have a whole ton of tests in process.
And you'll have numbers changing
every day.
Immediately.
Right? So you're going to have to the goal here would be to figure out some way, as the commissioner said, to maximize the way we actually share information as quickly as possible, but to do it in some way where there's some understanding about what the break point is in terms of what's coming out now versus what's actually work in process.
So the marathon has been postponed until September. There is right now, the Bruins and the Celtics are shut down. The Red Sox are paused for a bit here. Are all of these things merely going to slow down the spread, or is it actually going to stop it from reaching more people? I'd be curious what you both say about it. Doctor, let me start with you. Will it count in actually stop it, reaching more people?
The entire goal of what we're doing right now is to do what everyone is talking about, is flattening the curve. And just to explain for a second what that means, that is making sure that as little people as possible become sick from this virus, and as little people as possible end up needing hospitalization, and therefore being able to give our healthcare capacity the room it needs to do the work it needs to do.
As opposed to actually limiting the numbers, that probably is not likely. Is that what you're saying?
When you look at the modeling related to this disease, it depending on the model you use, we are not only limiting the number, but we're spreading it over a longer period of time and having the severity of the illness be less.
Let me address something. When I walk in the grocery store, the toilet paper shelf and the paper towel shelf is empty. The stuff is still being produced. What's the issue here? Is this the scare? This is the scare?
Well, if you have a rumor out there that the administration is about to impose, a 2-week shelter in place, a lot of people are going to end up heading to the store and buying what they think they need to survive a 2-week shelter in place. I mean, I said yesterday that, the stores get restocked every day. I mean, they do. You can just watch it happen. We don't have a shortage problem here, but I think people are basically working on the theory that either the rumors or whatever else, they want to be sure that if they have to stay home for an extended period of time, they have all the stuff they need to do so.
France yesterday banned restaurants and cafes from opening. They're all closed. Do you foresee a possibility down the road that this could happen here in Massachusetts?
Well, I don't like to. Again, we've been trying to make our decisions based on the facts as we know them, and then pointing out that this is an evolving situation. I think the example of what Boston did, which was shut down the bars in South Boston yesterday at 11, shut them down again today. I believe they'll probably shut them down on Tuesday. That is a facts on the ground evolving situation decision.
St. Patrick's Day also being a very big holiday here in Massachusetts.
I certainly think that we are probably going to need to talk with our colleagues in local government and come up with strategies to ensure that we deliver on the social distancing thing. And if what we've put in place with the 250 on large gatherings isn't getting it done, then we need to reconsider that.
Dr. Burrell, we asked the governor, Janet asked the governor this in the last segment. Let me go through it with you. Will you get on an airplane? Will you get on an airplane?
At this time, I would not get on an airplane for non-essential travel.
Would you eat in a restaurant?
I would say I would do the same thing as the governor suggested. If I could keep social distancing and if I could keep a safe distance, I would. But I also agree with doing takeout and other means as well.
Do you feel that you should be tested?
I don't need to be tested at this time as I don't have symptoms. If I were to develop symptoms, I would be appropriately tested. I do want to say one thing about this whole thing related to testing and symptoms and stuff. It's very important for us all to share the message that the vast majority of individuals will have a cold or flu-like symptoms from this illness that can be cared for at home. So it's really important if anybody has colds or flu-like symptoms, they should stay at home and not expose other individuals. If they feel ill, if they feel like their symptoms are getting worse, then they should call their healthcare provider and potentially get testing and other treatment. But it's really important for us collectively as a community, stay at home if we're sick, take care of each other, and do the social distancing so that you're not doing non-essential things in your day-to-day life that can expose yourself and others at high risk.
Doctor, thank you for your time, Governor. We
Thank you for
greatly
coming.
appreciate you both coming in.
By the way, can I just say one final thing to your audience? We're probably going to be doing media avails every day, okay? Because this is moving quickly. People need to know, and we want to make sure that to the extent we can deliver what I would describe as sort of official messages, we're doing so and trying to deal with stuff like the rumors.
Governor, thank you. We'll be right back.